we will be exploring. We will be exploring into various aspects of international patient summary-based data exchange, including its benefits, challenges, and the collaborative efforts required to ensure its widespread adoption. We have the privilege of hosting Mr. Ajinke, who has experience of global implementation and also has a brief understanding of our Nepal scenario as well. Also, from Nepal's side, it is important for us to understand IPS standards and how we can implement it in our context, where we are heading to enhance patient care, improve clinical outcomes, and streamline healthcare processes. I request all of you to seize this opportunity to foster meaningful dialogue and exchange knowledge that will drive us towards a future where healthcare data can be accessed globally for our own benefits. Once again, I extend my warm welcome to all of you, and I trust this session will be very knowledgeable and enlightening for us. Thank you. Over to you, Pavitra. Thank you.
Thank you so much, sir. Now I'd like to explain some basic rules of today's webinar. Everyone should mute themselves till you have something to say. And QA session will be held after the speaker's presentation. So I request everyone to put your questions in the question box if you have any during the presentation. So with this information, I'd like to provide this floor to a technical lead for SIL-Nepal, Mr. Sanjay Paudel, sir, for the review of the past webinars and activities of SIL-Nepal. Over to you, sir.
Am I audible?
Yes,
Yes,
sir.
yes, Sanjay.
Yeah. Thank you, everyone. Thank you for your great participation. So, as Pavitra mentioned, this is truly benchmarking initiatives from SIL Nepal. This is the very first kind of this from the initiation of Ministry of Health and Population. Today, our main topic is within the IPS, but before jumping into the session, I would like to have a short review at what we mentioned in our previous webinar. So, first webinar was mostly around the SIL Nepal and interoperability and the present context of interoperability within the Nepal's healthcare system, wherein we try to make understand about the challenges and the future that what we have foreseen for Nepal's healthcare model. And then for the second webinar, mostly it was introduction about the interoperability framework that we've been envisioning for Nepal's use case, mostly around OpenHI, and Hiram sir mentioned his long year journey with experiences of digital health paradigm. And today, I feel I'm fully delighted to welcome my friend, my colleague, and my mentor as well, Mr. Azinke. So we've been working with this global good and global digital health component since 2016-17. He is also the consultant for SUNY Competing, wherein he is delivering his global experience in order to improvise the healthcare system, digital healthcare system within Nepal. And I feel the webinar will give us as a catalyst role to understand about the IPS context within the global context, and also his experience with recent implementation in Sri Lanka. Over to you, Azinke. So in order to give you the context, here we have esteemed representation from different organizations, including government office. Dr. Azud, sorry, is here. Warm welcome, Dr. Azud. And also from the Community Health Toolkit, Medic Mobile, and I'm sorry, I might missed out, but everyone is from a different multi-dimensional organization, and I believe this webinar will help us to understand more clear about the IPS and its avenue that we've been thinking about to implement in Nepal going forward. Thank you. Over to you, Azinke.
Thank you, Sanjay. I hope you guys can hear me. Okay, thank you, Pavitra, for the initial introduction, and with the other. I would like to thank you everyone here who is present for this webinar. So as Sanjay has talked and Pavitra has talked, this is the first session we are taking from the IPS perspective. We'll try to keep it interactive. I know we have a Q&A sessions at the end, but if any of you have any kind of questions in between, you can raise a hand and then we can talk about it. Okay. I'm sharing my screen. Let me know if you can see it. I cannot see any of you. Actually, I'm on another screen. Okay, Sanjay, thank you. So the topic of our this webinar is connecting care and how we can utilize this to basically globalize healthcare unity and also advancing care through international patient summary. So good afternoon, everyone. Today, I'm very excited to discuss how the International Patient Summary can really revolutionize global healthcare by ensuring that every patient's health can be accessed ubiquitously, which means accessed anywhere, everywhere, ensuring better emergency care, chronic disease management, and preventive healthcare across borders. We'll start with you know the the main commitment or how it actually got started. In one of the G7 meetings happened in 2021, this statement came out wherein all the G7 ministers they decided that we all commit to work towards adopting a standard minimum health data set for patients' health information, including through the International Patient Summary Standard, with the shared objectives of facilitating health interoperability within and between countries, developing internationally shared principles for enabling patient access to health data, based on the principle of informed explicit consent or patient permissions, and in keeping with countries and regional existing legislative frameworks, and facilitating and promoting the use of open standards for international health data to encourage the widest possible adoption of standards and get greater interoperability. I know this is very big word, but this is the statement that actually made sure that IPS is something which can be really taken up and make it should be possible for people to share their data across the borders. It can be regional borders, it can be the national borders. So we'll start with what exactly is International Patient Summary? What is the core concept of that? So the International Patient Summary is a standardized tool for documenting essential health information accessible worldwide. It is a critical tool in modern healthcare. It provides a concise collection of essential health data that is crucial for effective treatment, especially in urgent care scenarios locally and abroad, where local medical systems might be unfamiliar with patients' medical history. It is designed to support health interventions during emergencies and ensuring continuity of care. It contains critical health data like allergies, medications, past surgeries, any conditions, and vaccination history. So this is the core of International Patient Summary. This is how it all started. Why do we need it now? What has exactly happened that this change is really required? So as Nepal has taken a first step towards interoperability, all other countries, developed countries, they are also moving towards how things can be made really interoperable in their own country as well as outside the country. So as global mobility increases, so does the need for accessible healthcare data across borders. It also means that the demand for accessible healthcare data is increasing wherever his patient is going. For example, one of the major scenarios that we always keep talking about is a lot of Muslim peoples, they go for Hajj. When they go for Hajj, they stay in the other country like Saudi for almost like a month or so. And it is a big period. So if anybody requires any kind of treatments, so it becomes very difficult for them to treat the patients. So that is the reason, if you really see Saudi and Middle East is they are trying to become very big into this, and they have taken a major step towards implementing international patient summary in their health interoperability scenarios. It serves as a safety net that allows healthcare providers to give immediate insight into a patient's medical background, drastically reducing the risk of errors. Pavitra, I see some of the questions. If there are any, just ping me, okay?
Sure, sir.
Okay. So what are the key components of an international patient summary? The IPS includes critical health information such as medical conditions, medications, allergies, and past surgeries. The information can significantly impact medical decisions, particularly in emergency situations where time is of the essence and errors must be minimized. Such accessibility can mean the difference between life and death. So the design focus of interoperability, ensuring that the data can be effectively utilized by different health systems worldwide. So in this blocks, if you see, we are looking at the key components. So the components that you are looking in the dark, the dark blue, the filled versions, these are the major components which are like minimum, they call it minimum data set, which should be always available to the people across nation or in your regional border areas. So IPS sections data, they usually define it into the data blocks. So the G7 IPS divides the block into two groups, the minimum data set and additional data blocks. The minimum data set is the data which will be shared between G7 countries, and it consists of patient demographics, allergies and tolerances, health problems including diagnosis, immunization and vaccinations, and current medications. The additional or remaining data blocks can be shared when and if the country wishes to. These are care plans, advanced directives, for example, living wills, functional status, observed conditions, history of past problems, history of pregnancy, operative procedures, medical devices and implants, social status, including lifestyle factors, vital signs, for example, BMI and blood pressure, and all medication. Which are the standards that govern the international patient summary? It is ensuring consistency and compatibility. So IPS relies a lot on international standards such as HL7 Fire, SNOMED GPS, SNOMED CT, ICD-10/11, and ISO Health Informatics standards to ensure data consistency and accuracy. So SNOMED, what they have done, usually they have a license model, but particularly for IPS, they created SNOMED GPS, which is a free set that can be used by the countries in order to make sure that the codification that is done, the terminologies that will be used by the EMR systems are same, so that whenever it goes across the countries, it is going to have the similar meanings. So these standards facilitate the secure exchange of data and maintain its integrity across different healthcare IT systems. Adherence to these standards guarantees that IPS documents are globally understood and accepted. The data sets specify the type and format of information to be included in the IPS, but do not specify the terminologies or classifications to be used. However, preferred terminology bindings are documented in this FHIR IPS format, which basically takes us to the HL7 FHIR. I'll share this presentation so you guys can take a look at that. So this is the subnational G7 IPS model, wherein it basically says that how this model can be utilized within the country itself. If you really think if you can break the overall country into small pieces of provinces. So for example, Canada has 13 provinces and territories, USA has 50 states, and the UK has 4 home nations. In these countries, developing a single national IPS data points may neither be possible nor desirable. Like for example, India, we have different states, our culture is different, our languages are different. So creating a single IPS is going to be a problem with the same data points. So the portability of data across these internal borders will improve healthcare, accessibility, and choice for the public. So for some G7 countries, using IPS FHIR standards will be an effective way to share information across their subnational borders. However, other countries such as the USA and their consolidated clinical document architecture have established processes for information sharing, and it is expected that they will continue to use this. So the roadmap has built-in flexibility for countries so they can adapt to this depending on their country structure. But overall, because of the base foundation of IPS, it can be adopted by anybody. Now, what is basically this was all about IPS, and now how this overall it plays a role in the data exchange is what we'll talk about. So effective data exchange underpins the utility of IPS, enhancing patient safety by providing comprehensive health information at point of care. Because what we are saying right now is IPS is a summary, but it also provides a lot of valuable data between the systems. So in case of interoperability systems, when you have multiple EMR systems coming in picture and different kind of hospitals like cancer hospital, uh, pregnancy hospital, maternal child hospital, all those kind of hospitals, they can actually have this data connected. It becomes really very powerful data, which doctors can utilize. So this ensures that healthcare decisions are based on the most complete and up-to-date information, thereby improving treatment outcomes. It is very critical in public health scenarios for managing epidemics and providing coordinated care during health crisis. So this has been seen particularly in case of vaccinations. Like when I'm doing this implementation in Sri Lanka, we are figuring out like they have lot of data, particularly about the vaccinated patients and vaccination data. They want to bring that vaccinated data into the system, and we are trying to figure out a way to add this vaccinated data in the system in a very smooth way possible, and that can be made as part of the IPS. So what are the benefits of implementing an IPS? In emergency care, IPS can be life-saving by providing essential health information swiftly to medical personnel. For chronic disease management, it facilitates consistent and informed care regardless of geographical location. And it also it also gives preventative healthcare practices by maintaining an accessible record of past screening and vaccinations. How it really works in emergency care is it is just one of the scenarios. So let's consider a real life example where a Spanish tourist in Thailand suffered a severe allergic reaction. Now access to his IPS record allows the emergency team to quickly administer the right treatment by avoiding drugs he's allergic to. So this is just a small example wherein just by knowing allergy, they can do a lot of simplifications. We have seen multiple cases wherein because of the allergies, patient has died. So this it becomes very critical if he's not in his home city or particular country, then outside country, this kind of scenarios become very critical. Legal and ethical considerations. So the most important thing here is privacy that keeps coming up whenever we talk about this: privacy, consent, and data protection. IPS must navigate complex legal landscapes because every country has their own legal ethical standards. Adhering to stringent data protection laws, for example, in GDPR in Europe and HIPAA in United States. Ethical management of patient data ensures that it is used responsibly, maintaining the trust of the public and upholding the dignity of individuals. So policies must be crafted to address issues of consent, especially in emergencies where obtaining direct consent might be challenging. So navigating this complex landscape of international data protection laws is crucial for IPS implementation. Because, for example, under GDPR, patient data can only be shared with explicit consent, which poses a challenge in emergencies where a consent cannot be obtained. Thus, IPS systems must be designed to uphold the highest ethical standards while ensuring patient privacy and trust. So in case of patient portal systems or national systems, it becomes very important that regulatory rules are designed in a way which will support IPS with at least the minimum data sets. How can we achieve interoperability with IPS? So basically, true interoperability requires seamless communication between multiple healthcare systems, often involving different languages and medical practices. So strategies include developing common data elements and shared protocols that transcend local practices. Success stories from various countries show the feasibility and benefits of achieving interoperability, facilitating better outcomes on a global scale. What we have found out in Sri Lanka is basically what they did is the whole role or the major role was played by ministry on designing the fire IG. They made sure that fire IG is so strong. Water is the whatever are the EMR systems, they should be able to adhere to it. And the another thing that they did is the terminology services. They created a terminology services registry using OCL, and they are still building on top of that. And they use the whole HI framework, OpenHIM as a platform, and integrated OCL with OpenHIM, and created their own regional fire IG and national fire IG. And that is how they made sure that the whole system can talk to each other. All the EMR systems can talk to each other in a very seamless way. This is a small case study, actually, the European experience. The European Union's e-health digital service infrastructure provides a stellar example of IPS in action. By facilitating data exchange across European borders, the initiative has not only enhanced patient care, but also provided valuable insights into how much systems can be implemented on a larger scale. We can draw important lessons from their approach to both successes and challenges. As I was giving you example of Hutch trips, this is very similar to that. Global initiatives and collaboration. WHO and other health organizations actively standardize and promote IPS to unify global health data practices. So this has recently started, wherein a lot of international groups, they are coming together and promoting IPS in a big way. International collaborations such as cross-border health agreements enhance the implementation and effectiveness of IPS by sharing knowledge and resources. Successful global initiatives have demonstrated improved health outcomes by facilitating accessible and reliable health data. What we have also found is this is a challenging aspect for governments, because the kind of infrastructure you have to set up, particularly when anybody wants to access the data from outside of the country, it becomes a challenge, legal challenge. So the regulatory authorities, they really need to craft the policies in a way that even the technology can work in a seamless fashion there. IPS as a tool for public health management, it streamlines public health management by offering real-time access to health data, critical for emergency responses and disease tracking. It has proven essential in managing public health emergencies by enabling quick and coordinated responses to outbreaks. Specific studies from recent public health crises illustrates how IPS has significantly enhanced surveillance and response strategies. So it plays a very crucial role in public health by providing timely data. For instance, during an epidemic, IPS can help health authorities track the spread of disease and understand patient histories to better coordinate response efforts. This kind of information is invaluable for effective public health surveillance and intervention. So what is the future vision for IPS? The future of IPS involves its integration with broader healthcare systems and emerging technologies, aiming to achieve a seamless global health data ecosystem. Long-term goals for IPS include supporting universal health coverage and improving health equity across different regions. The evolution of IPS is directed towards creating a universally accessible, secure, and efficient system that enhances healthcare outcomes worldwide. Looking forward, IPS stands at the forefront of healthcare innovation, actually. So as we integrate cutting-edge technologies and expand global healthcare initiatives, IPS will play a pivotal role in shaping a globally interconnected healthcare systems. This vision of comprehensive health interoperability is not only achievable but essential for future of global healthcare. Finally, a call to global action. We all have to join forces for enhanced healthcare worldwide. So basically, as we have talked about, the International Patient Summary is more than just a document. It's a tool that can significantly enhance global health outcomes. Today, I call upon each of you, whether you are a policymaker, healthcare provider, or technologist, to support and advance the implementation of IPS. Together, we can work towards a future where every individual, regardless of where they are in the world, has access to safe, efficient, and coordinated healthcare. Thank you. Any questions?
Thank you.
Thank you.
Sir, thank you so much for providing us the insights on importance of IPS and how it facilitates the data exchange between different healthcare facilities and providing us with a real-time example with a case study from Europe. Uh, uh, now, now we are moving to the Q&A session. If you have any questions, you can put forward your questions in the chat box or simply turn on your mic and put your questions to our speaker. And we have few questions in the chat box, and I would like to read out the first question for you, sir. Do we consider this as the digital health passport where people can carry their health summary on themselves and facilitate the care consideration coordination?
Yes, that's exactly. It is rightly said. Actually, it's a healthcare passport or passbook, whatever you can say that. So you will all have a health ID, and what happens is every country have multiple IDs, national ID, passport number, senior citizen number, healthcare number. So all those are IDs. So your system must be accessible by any one of them, ideally, and then using any of that, your system should give you the IPS. And I think the second question Sanjay has raised is, do you think with the use of IPS, the problem that we face during pandemic in terms of contact tracing and vaccination information sharing will be easy? Yeah, so I won't say it will be easy, but it will be uh, rather it will be easier later once you start tracking people into this IPS system, so you know that how many people are vaccinated versus not, and when you want to attach this to your passports, it becomes very easy from that perspective, Sanjay.
Thank you, Ajinkya. So the reason that I raised this question is we had the mechanism to share the vaccination information here in Nepal, wherein we developed the web-based application, and all of the vaccinated travelers were mandated. They were mandated to carry the QR and then share their QR where vaccination information was encoded, and was real challenge to share with few of the countries where uh, the restriction were there, because that was just the web-based application. And based on that experience, I just try to mention the thoughts around that. The other question is from debater: how will be patient uniquely identified?
The identification of patient, so you should actually implement MPI. Every country should have their own MPI, master patient index, MPI systems, that will allow you to have your own uh, patient identification, and whenever there is a cross border transaction that is going to happen, that patient identification will be always connected to that country. So it won't happen that the same identification number for a particular country gets copied. So the master patient index system that you implement in your own country will basically do the job of deduplication and linking of a patient to one ID.
Right. Since we are in the verge of finalizing the health ID or national ID, so we have not decided it, but what I would like to take the example is the cross-border payment system that has already been functional within the multiple countries. With the recent experience with a few of the implementations, for sharing the information, cross-border information exchange, what were the challenges that you faced in terms of the system? I mean, from the technology perspective. Let's
Sanjay,
say,
Sanjay, to
yeah,
be
let's
very
say,
honest,
yeah, sorry.
yeah, sorry, somebody else was saying something.
Yeah, my question is with the recent implementation with one of the country within your experience, so what was the challenge to integrate that system with other country system? Were there any challenges, or have you done any use cases around that?
No, as of now, no country is ready. Or rather, I would say very few countries have shown that readiness at this stage, because everybody is still implementing the interoperable system in their own countries as such. So, but at least they are drafting the policies that if it has to happen, how it is going to happen. because the most important here is the consent of a patient. I think there is another question which is related to that. So what happens in such scenarios is if it is not emergency care, then the consent is taken on cell phone, like OTPs and stuff. That is how it is happening. But if the person is in emergency care, then the minimum data set will be shown to the specific provider, and the provider has to be a doctor or something like that. So every nation, every country is drafting its own regulatory policies to make sure that it should not get you know uh, abused, that the whole system should not get abused because of the wrong policies.
I think to add on the answer that you provided related to consent, there is second question, follow-up question. How is it communicated and verified with multiple nations?
How is it?
Communicated and verified with multiple nations means probably is asking about the common meeting point where the information gets
So
exchanged.
what they are doing is they are maintaining the systems. For example, that the tracking systems or the request systems are being built. The consent portal, it basically tracks whenever you get a request, it goes through that consent portal. And so, for example, I'll actually tell you a scenario how what should be happening or how it is going to happen. Let's say a particular person of India travels to some other country, let's say Dubai, and something happens to that patient. And let's say Dubai raises a request for that particular patient because that patient's data does not exist in Dubai system. So they'll use their if you know about ipsweaver.com, every country is building their own weavers right now. So they will raise the request.
Hello. No voice. Yeah.
Azinka, I think you are muted or maybe. Yeah.
Yeah, I'm sorry. I think there was some network issue. So in case of this scenario of Dubai, what is going to happen? They're going to maintain another. So for example, if you are using Happy Fire, they'll be maintaining another database where the request is coming from. They'll track that, and they'll also maintain the data of the patients that they are treating in the international mode. And when the treatment happens for that international patient, that data they'll pass it to that particular country. For example, India, the data will be passed to India, and then India needs to use that data or bring in that data into their systems. The standard Happy Fire or whatever national health record they are going to maintain or data warehouse they're going to maintain, they'll have to bring it to that system. So it's a complex architecture from that perspective.
Thank you. The other question is a very practical question from Ganendra. How you guarantee that IPS documents are globally understand and accepted?
Yeah, that is the reason. IPS has its own format, as I said. So if you can look at the SNOMED GPS, where the codification is given, that can be used. So if you use those standard codifications like SNOMED GPS and stuff, then it can be easily understood by everybody. That is the reason they created those standards, terminology services standards.
Next question is, I think, around the EMR acceptance, but we'll try to answer that. This is a very vague question in terms of the acceptance of EMR, EHR.
I,
How
I
feasible? Yeah.
in Sri
Okay.
Lanka, we have seen a very good acceptance rate from the EMR side. Because they don't have to worry about IPS. IPS needs to be implemented at a national level. So at an exchange, it will get implemented at a data exchange level. EMR don't have to worry about that. EMR just needs to focus on the FHIR guidelines, which are generated by the country. And EMR used to use that FHIR guidelines and submit their data to the national systems. All the IPS-based weaving will be done at a national exchange. So EMR don't have to do any specific changes for that.
Thank you, Azinke. Are there any questions?
Hello.
We get
Yeah. I posted my question in the chat. Somehow it got missed out. is there any standard process of initiating this interchange between or among the countries? For example, if Nepal wants to get into in exchanging with Sri Lanka, what would be the standard process of getting into that? Are there any
So
standard process? Yeah.
yeah, so there is a guideline that is being generated. Sanjay, I'll share a link with you afterwards, after the call, and you can share it among the all the audience.
Okay.
Yeah.
Okay. That's great. Okay. So is the G7 even among the G7? This has not happened yet. They are still working on their own.
Yeah, they are still working. Like for example, US has already started it in their own local, I mean, in their national at their national level, but they have not started it amongst the country as far as I know.
Okay.
How IPS can be made secure and efficient as it is new system. So IPS is by default secure because you are interacting from IPS perspective, you are interacting with the national exchange. So if any data has to be pulled out from the national exchange, you'll have to give all the specific, it will be encrypted data. So all the keys and everything will be shared across the countries. So without those keys, you cannot fetch the data.
Yeah. One thing that I have in mind, and it might be a practical difficulty as well. For example, somebody, well, emergency is emergency. Somebody gets emergency situation in while traveling in India. A Nepali traveling in India gets into an emergency situation. Well, he or she may not have the ID and everything ready to identify him or her in the database. So in that case, is there a possibility that the thinking around that, the record can be searched through the demographics or some minimum set of data, instead of getting the whole ID, because this is a very practical thing. When a lot of people travel, they don't have either they don't carry the record, or sometimes it might not be possible. Is there any consideration towards that?
See, ideally in such scenarios, they must be at least carrying a passport, right? If they
Mhm.
don't even have a passport, then there is no identification system that they have. So it becomes very difficult because outside the country, probabilistic, we call it probabilistic matching using the demographics. So doing the probabilistic matching outside the country via IPS will not be, I don't think that will be really efficient, and I think it will be very difficult because it requires access to the MPI of the other country. So I think that will be difficult if there is no identification available.
Okay.
So
Okay, thank you.
yeah, I see one more query here. Is data exchange temporarily? Yes, so the data exchange is temporary, but the audits are maintained. Audit trail will be maintained. That this data is exchanged, and against this data, what is the medical treatment given? What are the procedures taken? So all that will be submitted to the source country. Patient consent is taken only if patient can give consent, and patient can see all this history of how where his data has gone, who has accessed his data in the ideally in the patient portal, because this is available in the audit trail. But if your country builds a patient portal, then you can also see that in the patient portal, like where your data got accessed.
Um, Thanks, Ajinkya.
You know,
I hope I pronounce your name right.
Yeah,
So
yeah,
just
that's
adding up on that question, like you mentioned that patient can see it, but does it mean that like my information is right now on the do nation right now, or if I'm using IPS, or is it like I have only exchanged the information for temporarily now after the treatment, the information is no longer in the country that I visited? How
So
does
they
that
will
work?
always maintain if that the country that you visited, they have done some procedures and they have done some medication for you. If any kind of encounter has happened, they'll maintain that, because even for that country, they need to maintain the trails of how many outside patients has been treated.
And can I revoke that at any moment, like if I want to?
Yeah, because you have not given that consent, right? The consent has gone through the IPS of your country to that particular country. If you have given consent, then yes, you can revoke. It all depends. If it was not in emergency care and you have given the consent, then of course you can revoke. That is how consent management should work. Does that answer your question, Neeraj?
Yes, somewhat. Thank you.
I've got a query like this IPS is a complete set of complete different is a separate is it a separate database, for example, with the, the the information is fetched from different sources and then it is consolidated into a cloud-based server, or you just request something to an EHR, for example, national connected EHR, in the when the systems are fully interoperable, and then they will really on the fly they will really compile and send you the data. Is it permanent
No.
storage of the IPS record, or how is it done?
IPS is a view. It is a summary. There is
Okay.
it is your standard data. So what they have done is in the HL7 they have created IPS specific fields, elements that you need to use to do the viewing of that data. You don't have to store it. It's a standard
Okay.
store that you will use.
Okay. Okay. Yeah. Okay. Thank you.
Okay, Sanjay, to you.
Thank you so much, sir, for addressing our participants' queries and questions. So the floor is still open for the quick Q&A session. So if you have any other questions, you can simply turn on your microphone and put your questions. So I consider this silence as there are no any more questions. So we are at the end of the session, and I would like to express our heartfelt gratitude to all of the participants joining us from the different sectors here with us today. And I would also like to express our gratitude to National Research and Education Network for providing us with a Zoom link. Thank you for your assistance, sir, Narayan. And our special thanks to our speaker for today, Azim Kesar, for your valuable time and for making this session possible. And at last, I would like to request everyone to please turn on your video so that we can take a photo. So if possible, I request everyone to turn on your videos. Okay, thank you so much, everyone. And for the next month, we'll be having a webinar on the topic which I'll be updating soon with the email. So thank you, everyone, for joining. Have a great evening. Thank you.